Coming to the airway fire management. So whenever a fire happens inside the airway or inside the OT, there is a management protocol of every hospital how to deal with the situations. But just in the previously with the lecture we have discussed how to prevent it, how to prevent the airway fire, because always prevention is better. How to prevent it? Suppose some amount of it is always advisable to use that type of tubes that are laser resistant, and whenever you have not supplied with that type of tube or that type of cautery, it is always advisable that you should be always vigilant to the airway. As much as you are vigilant, and as soon as the airway catches the fire, you should always go on the management of the airway fire management. So coming to the airway fire management proper, all the hospitals have their own protocol, but the most commonly followed protocols we are discussed here. Fire is not present, continue. Suppose there are early warning signs of fire. So early signs of fire, there is a smell of the fire always comes from the airway. Burning sensation or the burning smell will come from the airway. There the patient may develop some amount of hypercarbia or some amount of desaturation, or the surgeon notify the anesthetist the airway fire may happen. So these are all the warnings, early warning signs of the fire. We have to look at the site. So when we supposed to look at the site of that the fire has happened or not. If the fire is not present, continue the procedure. If the fire is present, then halt the procedure and look for some time. If there is a fire is present and you are evident that fire is present, then totally discontinue the procedure. If the fire is not present, then we can continue the procedure. Suppose the fire is present, immediately what you have to do? Remove the tracheal tube, because the tracheal tube is the main source of ignitions. Because the tracheal tubes sometimes it is made of plastic, PVC, they rapidly catch fire, and whenever they catch fire, it will be rapidly spread to the lower airway also. So remove the tracheal tube immediately. Stop flow of all the airway gases, because airway gases we have already discussed, these are also coming in the airway thread or fire thread. So we stop flow all the type of airway gases like oxygen, nitrous oxide, air, everything should be stopped. Remove flammable material from the airway. By any means, you have to remove the flammable air from the airway by doing a simple laryngoscopy or gentle laryngoscopy or direct laryngoscopy. You have to remove all the flammable material from the airway. Pour saline into the airway. Irrespective of the type of the burn, irrespective of the type of the inflammation source, you have to just pour the saline inside the airway. So immediately these four things should be done. What are the? Remove the tracheal tube, stop flow of all the anesthetic gases, including the inhalational agent, oxygen, nitrous oxide, air, whatever may be. Stop all the flows. Remove the inflammable material, flammable material from the airway like drops, drapes, tubes, everything you have to remove. Pour as much as saline into the airway till the signs of the airway will stop. Like whenever you are hearing a sound like pops, drips, this type of whenever you are hearing such type of sound, and whenever you are smelling such smell of burns, at the time you just go on pouring the saline into the airway till the signs are disappears. So now you check fire is out or fire is not out. If the fire is out, re-establish ventilation. So but before starting the ventilation, you have to properly check whether the fire is out or not. If the fire is not out and you are again starting the ventilation, you are again giving oxygen, then it is higher chances that the fire may reoccur. So before re-establish ventilation, it is always advisable to check the airway or to check the fire is out or not. Avoid oxidizer and rich environment. So it is always whenever you are re-establishing ventilation, you try to put lower amount of oxygen to the circuit. Examine integrity of the tracheal tube. Bronchoscopy to assess airway injury. In this case, bronchoscopy is having a highly vital role. Whenever you are doing a check bronchoscopy, you can easily identify the type of the burn present and which part of the airway is involved in the burn, what is the extent of the burn, and how to prevent it, and what are the sources that causing the burn. So this type of things can be easily accessed by doing a simple bronchoscopy, and bronchoscopy must always be done whenever you are having a fire inside the airway. Suppose fire is not out. By doing these four things, remove tracheal tube, stop all the flow of anesthetic gases, remove flammable materials, pour saline. By doing all the procedures, the fire is not out. Now you use CO2 extinguisher, active fire alarms, evacuate patient and close the operating room, turn off all the gases. So here it is advisable to leave the OT, not to leave the patient, just leave the OT. Just use as much as CO2 extinguisher as possible, activate the fire alarm protocol, evacuate the patient and close the OT room and turn off all the gases. Turn off all the gases. It is when the fire is not out. Mostly by doing this four simple maneuver, always the fire is out and mostly the patient life can be saved and we can easily re-establish ventilation. When we are not able to control the fire by doing all these four maneuvers, we have to remove the patient from the OT. We have to switch off, or we have to shut off all the source of airway, or all the source of gases inside the OT, and we have to evacuate, or we have to just put the alarm of the airway fire management, and the peoples who are involved in the airway fire management, they all will come and they will finally diminish the airway. Assess the patient status and start follow up and care. So after removing the patient from the OT, we have to assess the patient status, and we have to follow up the management. This is the triad: oxygen, heat and fuel. What are the oxidizing source, what are the heat source, what are the fuel source, we have already discussed. How to prevent it: avoid using ignition sources near the oxidized and enriched environment. So whenever airway fire management protocol will come, you have to just write this slide only. In the exam, this slide only, it will cost 5 marks. Prevention and management. Prevention and management. What are the source? These three triad, the triad of the airway. Just give on heading the triad of the airway fire, 1 mark. Prevention another 2 marks, and the management another 2 marks. So 2 plus 2 plus 2 1 is equal to 5. So 5 marks from this only single slide. This contains 5 marks. Prevention: avoid using ignition source, oxidized in environment. Configure the traps to avoid oxidizer accumulations. Allow flammable skin preparing. It should be always completely dry. This is the most common thing. Whenever you are applying some amount of alcohol containing solutions before starting the OT, you have to leave the solution for to be completely dry. Moisten sponges and gauze. Surgeon must announce the intended use of the device. So it is both the communication between the surgeon and anesthetist is vital here. The anesthetist must also notify the surgeon that no, the environment is very much oxidizing risk or oxidizer risk. We are giving 60%, 70% of oxygen. And also the surgeon should notify the anesthetist that no, we are going to use some amount of ignition source inside the airway. Please keep your oxygen or your environment oxygen free or lower concentration of oxygen. There will be close communication between the surgeon and anesthetist. The airway fire can be prevented easily.